Macular Degeneration New Zealand is a charitable trust with a vision to reduce the impact and the incidence of macular degeneration in New Zealand. In a nutshell, 1 in 7 over the age of 50 will be affected by macular degeneration. It is the leading cause of blindness in this age group in New Zealand. In the wet form of macular degeneration, abnormal blood vessels grow into the retina. They leak, they bleed, and they form scar tissue affecting our central vision. This may happen really rapidly. It may happen in weeks and months. Now there's treatment that is available which can halt the progression and may in fact stop vision loss. However, for many people, it's simply too late. It's a big problem, and it's getting bigger. So about 1.5 million people in New Zealand are at risk. Currently, 200,000 are diagnosed, and 20,000 people already have vision loss as a result of macular degeneration. It's a 3-step problem, and there's a 3-step solution. We need to reach those who are at risk at an early stage so that effective treatment is given and fewer people lose vision. And it's bigger than you think. It's up there with heart disease, and it's over half as prevalent as diabetes. So we knew that macular degeneration-related vision loss costs this country hugely in healthcare costs, productivity loss, reduced personal well-being, and all the associated costs with the burden of disability. We didn't know how big those costs were, and nor did we know how much could be saved with an investment in awareness and early treatment. We felt that it would be something like spend a little and save a lot. But we needed proof, and that's where the Deloitte document came about. So with funding from the Rapanui Trust, Macular Degeneration New Zealand commissioned Deloitte to find out how much it costs New Zealand society with macular degeneration. And it produced this document, the Socio-economic cost of macular degeneration in New Zealand. We were surprised at just how big that cost was. $391 million this year. This includes economic as well as loss of well-being. Now, Deloitte also uncovered that increasing awareness is the key to reducing blindness in New Zealand. They identified that early detection and treatment could save New Zealand society an estimated, wait for it, an estimated $75 million per annum. And they concluded an increase in awareness and education of AMD would lead to reduced burden of macular degeneration through timely and adequate provision of treatments. Awareness is the key. And you only need to look at Australia to see why. Now, Macular Degeneration New Zealand has been working with awareness, and we've done quite well actually to increase our awareness, but we haven't done as well as Australia. Look how well they have done, bringing in our overall awareness to 92% of their population. So now let's look at response to treatment over a number of years. As a result of their high level of awareness, Australia has reached more people at an early stage, resulting in a comparatively greater improvement in vision As we see here, with the dark, with the dark blue, and over all years, they have maintained better vision. This is compared with Europe, UK, and USA in the light blue. And also, the green blocks represent less proactive treatment with poorer vision outcomes over a 3-year period. So, superior awareness leads to earlier treatment, and good treatment management leads to better long-term vision. Now, Australia and New Zealand, we have the same problems. We have comparable population, we have similar lifestyle and environment. Here we have a proven case of the benefits of awareness and early treatment programs. We simply need to emulate this strategy in New Zealand to realise real reductions in vision loss. But Macular Degeneration New Zealand can't do it on its own. The Deloitte report clearly shows that the economic, social, and personal cost of the status quo is too big to ignore. Government funding will bring a return on their investment many times over. Medical, eye care, aged care professionals need to ensure that their patients and clients know about macular degeneration, are aware of the early signs, and how vital it is to seek early treatment if they have warning signs. Business and communities can be doing their bit by supporting Macular Degeneration New Zealand through donations and sponsorship. Together, we can make a huge impact on this epidemic. It starts with step 1, awareness and early detection. And now Professor Alan Bird will take you on the next step, the treatment of macular degeneration, the incredible advances currently available, and on into the future. Professor Bird, just one moment. Professor Bird has been my long-term mentor, and it's an absolutely huge privilege to have him here in New Zealand. But I'll invite Professor Charles McGee to introduce him.